one of my favorite cortex applications is the CT, NeuroQuant CT. And so before we jump into the cases, as you guys have probably heard of, this is an application that automatically aligns the CT images, it registers them over time, and it can create subtraction images. So let's look at a couple examples. This patient was found down at the airport. They had had a prior craniotomy for meningeal resection, which is a benign tumor, but now were found down. We can see at this first time point, we have our standard axial CT and our neuro. So these actually don't look too different, right? So in this case, you'd say, well, how much is it actually helping you? We can see that this patient has a large intraparenchymal hemorrhage as well as an extraaxial hemorrhage underlying that prior craniotomy. But when we look at the follow-up scan 2 hours later, if we're just looking at this scan, it's sort of hard to compare these, right? For me, if I'm just looking at that and I'm trying to meet this quickly, doing a quick comparison when the head is tilted, these patients obviously are altered. They often come in with heads tilted. And so what NeuroQuant does for me is it aligns it perfectly to the prior image, to the prior imaging time point. So now I can do an apples to apples comparison. And I can also look at the subtraction images, which we love, because looking at the subtraction images tells me right away what's happening with this hemorrhage. So when I see an area of increased density, attenuation, I know that's the increased hemorrhage. So I can tell exactly where that hemorrhage has increased. I can also look for areas of decreased attenuation, which in this case indicate areas of increased edema. But on a side note, that's also, we found it helpful for looking for areas of stroke, because with stroke, you also get the decreased attenuation. And then looking at the ventricles, we getting this sort of funny thing happening where one frontal horn has increased attenuation and one has decreased. So what does that mean? It means that things have shifted. And in order to quantify the degree of that shift, we can look at this lovely report, which tells us that at the prior time point, at the initial time point, there was about a 4 millimeter shift, and now that's increased to 11 millimeters. So again, being able to very confidently and quickly figure out what's going on from time point 1 to time point 2, and also being able to quantify the midline shift is very helpful.